Hi, I'm Brenda Schwarzbach, and we're going to be working on the back today. Your client should be comfortable lying face down in the face cradle and should be draped modestly. The first thing you're going to do is you're actually going to be putting the oil on. This client already has oil, so you won't actually see me do that. But you want to cover the whole back all the way from waist to shoulders, putting on the oil. The next thing you're going to be doing is you're going to be doing the kneading or the petrissage movement along the side closest to you. Make sure that you actually lift the tissue and move the muscle. Start at their waist, over the ribs, and then all of the way up to the shoulders. Do this kneading motion on the side closest to you, and then reach over to the other side and pull the tissue and the muscle toward you. Sometimes you can actually get a better grasp of the tissue with the muscle on the other side. Go over the shoulders. Spend a little extra time on the shoulders. These muscles are generally tight on everybody. You'll do a little bit of maybe loosening up with the joint in order to be able to grasp the muscle tissue. Transition back to the waist, and then what you're going to do is you're going to transition from this side of the table to the other side. You'll be doing the same motions on the opposite side of the table, but begin with the kneading motions closest to you. So you're going to work your way up, fingers staying just lateral to the erector spinae, transitioning from arm to shoulder, and then take a little bit of time and work directly over the erector spinae, loosening up the tissue all the way to the shoulder, over the trapezius muscle. It's kind of like a come and a come again type idea. You're going to be loosening up a little bit of a tissue, see where it's tight, and then get a little bit deeper into the areas where you feel it needs more attention. Usually those postural muscles on either side of the spine need a little bit of extra attention. Take your time, especially through the area where the insertion for the levator scapula is, and then follow it up over underneath the upper trapezius muscle. So you're going to be doing a breaking up and then a smoothing out. You'll also do the erector spinae and the loosening of the upper shoulder on the opposite side as well. So you've walked around the table. Always keep in contact with your client so that they know where you are. Spend some time on the deeper muscles. You should have loosened up the superficial muscles, and then you work a little bit deeper. Now you're going to bring the arm out close to you, and you're going to work a little bit of extra time on the shoulder, working around the scapula, above it and below it. And then you're going to do a passive with a active stretch. And the stretch is going to be for the latissimus dorsi and also the lower trapezius muscle. So the mechanics of this is that you will grab the muscle, then you'll bring the arm off the front of the table and then drop it down toward the floor. What this does is it passively stretches the muscle while you're also actively stretching it with the heel of your hand. Should be a nice, comfortable stretch, taking your time. Your client should always feel supported during this motion so they don't tense up. Gently bring the arm back to the table and then walk around, and you're going to do the same thing on the opposite side. First, loosen up the tissue around the scapula, and now you're going to do the same stretch on this side. So gently hold the arm in one hand, drop it off the front of the table slightly as you use the heel of your hand to lengthen the lower trapezius and the latissimus dorsi. When you're finished, go back to the shoulder, Loosen up the tissue, and then you're going to begin the twist. This is a pulling motion with one hand and a pushing with the other, going across the body from shoulders to waist. After you've gotten to the waist, you'll come back up to the shoulders, covering the whole body. And now walk around to the head of the table. The last motions that we're going to do to complete our massage is kind of like putting the body back together. And that includes coming off of the hair, especially if your client has long hair. Now the idea here is to actually loosen up those shoulder muscles one last time. You're going to lift with the heels of your hands, and you're going to push that upper trapezius muscle down their back and then continue along either side of the spine. You'll relax your hands as you go over the kidneys and then just have light pressure at the hips, light movement up, over the shoulders, transitioning nicely up through the neck muscles, off of the hair, and then one more time, grab that upper trapezius muscle, and you're going to push as you get through to the center of the back, and then loosen up again over the kidneys. You don't want to have any extra pressure there. Come back, and then you're going to go ahead and do the twist one more time. Comforting movements, pulling the tissue toward you as you push it away. Nice transition movements. Walk around to the other side of the body. Do the twisting motions here as well. It's kind of like you're saying goodbye to the client one last time. From shoulders to waist. And now you're in the perfect position to go ahead and then grab that sheet and cover your client back up. Then you're going to place one hand on their low back, one hand between the shoulder blades, do a little bit of a rocking motion, and then just come to stillness, signaling to your client that you've completed your massage. Thank you for joining me today. My name is Brenda Schwarzbach.